I still smell it sometimes, even now. That faint, metallic sweet odor mixed with antiseptic and warm plastic. The smell that only exists in dialysis units. The smell that crawls into your clothes and refuses to leave, no matter how many times you wash them. That day was supposed to be ordinary. That's what still scares me the most. Because nothing about it felt wrong, until it was already too late. And before I tell you about the blood, about the moment it turned black, you need to understand something about dialysis, because this wasn't a horror movie mistake. It wasn't negligence. It wasn't me being careless or distracted. It was something none of us were trained for. I'd been a dialysis nurse for a little over 5 years when this happened, long enough to stop flinching at needles, long enough to read lab values like street signs, long enough to recognize that particular look patients get when their bodies are tired in a way sleep doesn't fix. Dialysis units are strange places. They're loud and quiet at the same time. Machines hum constantly. Pumps click. Alarms chirp. But underneath all that noise, there's this heavy stillness, like everyone in the room is holding their breath together. Most of our patients came 3 times a week, Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Same chairs, same machines, same routines. You get to know them, their habits, their moods, their jokes. You notice who always brings crossword puzzles, who sleeps through the entire treatment, who complains every single time and still shows up early. You also learn what normal looks like. Normal blood color, normal flow rate, normal pressure readings, which is why I noticed it immediately. But I'm getting ahead of myself. That morning started like any other. I clocked in at 5:32 a.m. I grabbed my scrubs from the locker and tied my hair back in that rushed, half-secure way you do when you're already thinking about the day ahead. The unit smelled like disinfectant and stale coffee. The night shift nurse gave report while rubbing her temples. "Full house today," she said. "Machine 3's been acting up, but Biomed checked it." I nodded, logged in, reviewed charts. One name caught my attention. New patient, male, late 40s, recent transfer from another facility after complications. No big red flags, no allergies. Labs slightly off, but not alarming. Diagnosis, end-stage renal disease. Cause, unclear. I remember pausing on that. Most charts tell a story. Diabetes, hypertension, autoimmune disease. This one just said, etiology undetermined. I shrugged it off. It happens. He arrived a little after 6. Tall, thin, too thin. Not frail exactly, just stretched, like his body had forgotten how to hold weight. He smiled politely when I introduced myself. Quiet voice, calm, no complaints. That alone made me uneasy. Dialysis patients usually complain about the chairs, the needles, the temperature, life. He didn't. I checked his vitals. Blood pressure slightly low, but acceptable. Heart rate steady. Skin cool to the touch. "Feeling okay?" I asked. "Yes," he said. "Just tired." I prepped the machine, primed the lines, checked the dialyzer, verified settings, everything normal. The access was a central venous catheter, temporary, placed at the hospital. Not ideal, but common for new patients. I cleaned the site carefully. Sterile technique, muscle memory. He watched me the entire time, not nervously, just attentively, as if he was memorizing something. "First time?" I asked, trying to lighten the mood. "No," he said. "Just first time here." We started treatment at 6:41 a.m. Blood flowed into the lines. Bright red, healthy looking, considering everything. I relaxed. The first hour passed quietly. Machines hummed. A tech laughed softly at something on her phone. A patient across the room snored. I charted, adjusted settings, checked pressures. Everything stayed stable, until it didn't. At 7:58 a.m., I noticed the venous pressure creeping up. Not spiking, just climbing. I checked the lines. No kinks, no clots, no alarms. I flushed gently. Pressure dropped back into range. I made a note. 10 minutes later, it climbed again. I frowned. Sometimes catheters shift. Patients move. It's annoying, but not unusual. I asked him to adjust his position. He did. Pressure normalized. But when I glanced back at the bloodline, something made my stomach tighten. The color looked off. Not dark, not sluggish, just slightly wrong. I leaned closer. Still red. I told myself I was overthinking it. Then, at 8:23 a.m., the arterial pressure alarm chirped. I silenced it and checked again. Flow was slower now. I inspected the tubing. That's when I saw it. The blood inside the line wasn't red anymore. It wasn't dark red. It wasn't maroon. It was wrong, like someone had mixed ink into it. A deep, opaque color that swallowed the light instead of reflecting it. Black, not brown, not purple, black. My brain stalled for a second, trying to categorize it. Blood doesn't do that. I leaned closer, thinking it might be shadow or lighting. I tilted the line. The color didn't change. I felt my throat tighten. I checked the dialyzer. Same thing. The blood circulating through it looked like oil. "Hey," I said carefully, keeping my voice steady. "How are you feeling?" He turned his head toward me slowly. "Better," he said. "Actually." That didn't make sense. I checked his skin, still cool, slightly pale, no complaints, no distress. I looked at the machine again. No alarms. Pressures slightly elevated, but nothing critical. My mind raced through possibilities. Hemolysis, contamination, medication reaction, none of them fit. I'd seen hemolyzed blood before. It looks pinkish, sometimes cola-colored. This was not that. This was black. I grabbed another nurse. "Can you look at this?" I asked quietly. She leaned in. Her face changed instantly. "What the hell is that?" she whispered. "I don't know," I said. "I've never seen this." We double-checked everything. Lines correct. Dialysate correct. No mixing errors. She suggested stopping treatment. I nodded and reached for the clamp. Before I could close it, the patient spoke. "Please don't," he said. Not pleading, just firm. I hesitated. "I'm sorry," I said. "We need to pause until we figure out what's happening." He smiled. It wasn't reassuring. It was satisfied. "That won't help," he said. "It's already started." My pulse kicked up. I clamped the lines anyway. Blood flow stopped. The black liquid stilled inside the tubing like frozen tar. I checked his vitals again. Blood pressure dropped suddenly. Heart rate slowed. "Oxygen sat," I asked the tech. 82, she said. Too low. He still didn't look panicked. If anything, he looked relieved. I called for the charge nurse, then the physician, then a rapid response. The unit shifted instantly. Machines paused. Voices rose. Curtains were pulled. We lowered the chair, gave oxygen, monitored closely. His skin tone changed. Not pale, gray, like color was draining out of him from the inside. "Stay with me," I said, gripping his hand. His skin felt colder now, almost waxy. He looked at me, eyes strangely clear. "You can see it now," he said quietly. "See what?" I asked. He glanced at the tubing. "The truth," he said. His blood pressure dropped again. Alarms erupted. The physician arrived, eyes darting between monitors and lines. "What happened?" she demanded. "Blood color changed," I said. "I've never seen anything like it." She stared at the tubing. Her mouth opened slightly. "Get labs," she said. "Now." We drew samples carefully. The syringe filled with the same black liquid, not separating, not clotting, just thick, like it didn't want to behave like blood anymore. We sent it stat. The lab called back within minutes, confused, concerned, asking if the sample was mislabeled. "It looks contaminated," the tech said. Or synthetic? Synthetic. That word echoed in my head. The patient's heart rate slowed further. Bradycardia. The physician prepared emergency medications. "Sir," she said firmly, "can you hear me?" "Yes," he replied calmly. "You're not doing well," she said. "We need to stabilize you." He nodded. "I know," he said. "It's almost finished." "What is?" I asked. He looked at me, directly. "Borrowing," he said. The monitor flatlined. Chaos exploded. CPR began, compressions, bagging, medications pushed. I watched his face as we worked. No fear, no pain, just expectation, like he was waiting for something. After 8 minutes, we got a rhythm back, weak, unstable. He gasped once, then again. Color did not return. The blood in the tubing remained black. We transferred him to the ICU immediately. I stood there afterward, hands shaking, staring at the machine. The black residue clung to the inside of the lines. It took longer than usual to flush, almost like it resisted being washed away. The unit smelled different after that, heavier. The rest of the day blurred together. Incident reports, meetings, whispered conversations. Administration told us not to speculate. The labs never gave a clear answer. The blood sample degraded quickly once exposed to air, turned thick, then grainy, then useless. The ICU called later that night. He didn't make it. Cause of death, multi-system failure, unclear etiology. The chart was closed, but that wasn't the end of it. 2 days later, Biomed called. The machine he'd been on was malfunctioning, not electronically, physically. Internal components showed unusual corrosion, as if they'd been exposed to something acidic, or not meant to be there. They replaced the tubing, discarded the dialyzer, deep cleaned everything. Still, for weeks afterward, that station smelled wrong, subtle, metallic. I tried to forget it, told myself it was a freak case, a rare reaction, something science just hadn't named yet. Then a month later, I was starting a patient on the same shift. Different person, different diagnosis, different machine. As I primed the lines, I noticed something. For just a second, the fluid in the tubing darkened. Not black, not fully, just a flicker. Then it was gone. I froze, checked everything, normal. The patient was fine. Treatment went smoothly. But that night I dreamed of blood moving the wrong way, not flowing, watching. I started noticing patterns, patients waking suddenly at the same time, machines alarming without cause, that faint smell returning randomly. And sometimes, when I disconnected lines or flushed catheters, I'd swear the blood hesitated, like it didn't want to leave. I reported it once. The supervisor looked at me like I was exhausted, burned out. She suggested time off. I took it. But even at home, I woke up at the same time every night. Heart racing. Certain something was missing, or taken. I left dialysis 6 months later. Different specialty, different building, different life. But every now and then, when I pass a hospital and catch that familiar smell, I remember the way that blood looked. Not dead, not sick, just wrong. And I can't stop wondering, if it wasn't failing, what was it feeding? If you work in healthcare and you've ever seen something you can't explain, tell me. I need to know I'm not the only one.